Hello, my name is Arnold. I'm going to be your nurse practitioner for today. We're going to do the respiratory examination. For the purpose of this video, we're going to have this gentleman with his muzzle shirt, but it would have to be without a shirt to be able to perform this examination appropriately. So first we're going to inspect, we're going to start off with the anterior portion, then we're going to move on to the posterior portion. First we're going to inspect the patient and look for any obvious signs of respiratory distress, such as supraclavicular retractions, intercostal retractions, or sternocleidomastoid muscle usage. And we're also going to evaluate his respiratory rate, rhythm, and we're going to look at his AP diameter, look for any barrel chest, funnel chest, pigeon chest, frail chest, and we're looking for symmetry on the chest expansion, and any obvious cyanosis on the lips or anything that might indicate respiratory distress. That also includes any lesions on the skin portion, any sinus. Then after that, we're gonna move on to palpation. So we're gonna palpate the patient, checking for. Let me know if you have any tenderness. Okay. So we're gonna check for any costral tenderness, and you check for any crepitus. You have any pain, sir?
No.
Costochondrial tenderness. I'm sorry, I had a hard trouble pronouncing that word. So we palpated for any tenderness. There was no tenderness. Now we're gonna palpate, and we're just gonna do the anterior chest for now. We're gonna check the chest expansion, and what we do is, you can't really appreciate it with this angle in the video, but on the costal angle, which is basically the angle of the ribs, we're gonna place our thumbs. And right now I'm going to ask you to take a deep breath, pinch it a little bit, and you would see the skin, but at this angle or with the shirt, you weren't able to appreciate. If you could please take a deep breath. See, and then you see the fingers expand, and that's what you want to look for, symmetry. Make sure that the ribs expand evenly. Now what we're going to do is what's called a tactile affirmative. And with that, we're going to feel vibrations. We're going to use our ulnar aspect of the hand, and we're going to feel vibration. I'm going to tilt you this way a little bit so we can probably get a better angle. And we're going to compare sides, and we'll feel vibrations. Increased vibrations might indicate consolidation. Decreased is air, such as COPD. So can you please say 99?
99. 99. 99, 99, 99.
Okay, want to make sure we get all areas of the lung when we're palpating for tactile affirmatives. Now we're going to move on to percussion. For percussion, we're going to percuss and compare side by side in all areas of the lung, and we're listening for resonance. If we find any abnormal, such as hyperresonance, which may indicate asthma, COPD, or any dullness that might indicate consolidation, pneumonia. So now we're going to start palpating. Okay, so it was resonant all lung fields, and as I mentioned earlier, it would be without a shirt. For this purpose, we're going to use this. So we already percussed. Now we're going to move on and auscultate. So for auscultation, we're going to first do the interior. We're going to do all lung fields, the apex of the lungs, and then move on all the way to the bases of the lungs. We're going to make sure we also touch the lateral sides of the lung, and then the middle lobe on the right side. So every time I touch you, please take a deep breath. If you ever feel tired or short of breath, just let me know. Dizziness, just let me know and we'll take a rest, okay?
Okay.
All right, every time I touch your skin, okay?
Okay.
How are you doing? You're okay?
Okay.
Almost done, okay? Okay, so it was clear lung sounds, but we would be looking out for any wheezing that might indicate any asthma or any narrowing of his airways, or for any crackles that might indicate some fluids on the lungs. In his case, we have clear lung sounds. So now we're going to move on to the posterior portion. I'm going to ask him to shift over. Okay, so we're going to start with the same. We're going to do the inspection. Same thing. We're going to inspect the skin, inspect the expansion of the lungs, make sure it's even, any sinus tracts or any abnormal lesions that he might have. Then we're going to move on to palpation. We're going to palpate the areas of the lungs. Make sure. Let me know if you have any pain. Make sure if he has any pain or feel any crepitus, indicating any subcutaneous emphysema or air within the tissues. Okay, then now we're going to palpate and feel the vibrations. I'm going to ask him once again to say 99, and we're going to cover all field bases from the apex all the way to the bases. So every time I touch you, please say 99, and we're going to feel the vibrations. And as I mentioned earlier, increased vibrations might indicate consolidation, and decreased might indicate diseases such as COPD or pleural effusions. Okay, so can you please say 99?
99. 99. 99. 99. 99.
Okay, so he had normal tactile firmitism, or normal vibrations. So now we're gonna move on to the expansion of the chest, and this we're gonna use the T10. So if you could bend your head a little bit forward like that. So this one is usually the C7, and then we're gonna go all the way to the 10. It's much easier without the shirt, but with the purpose of this video, we're gonna do this. So T10, then we're gonna use your thumbs, pinch a little bit the skin like that, and then we're gonna ask the patient to please take a deep breath. There you go, and then you see the skin stretch and my fingers move evenly, so he has an even chest expansion. So now we're going to move on to percussion. We're going to percuss all areas of the lung, and it should also be resonant. For the purpose of this, we could ask the patient to hug himself or put his, and this, what happens, it opens the scapula, because if we percuss on the scapula, it will have a different sound and won't be resonant. So we're going to start with the apex, okay? And we're going to be comparing and make sure we get all fields of the lung. So, so all areas were resonant, so no abnormalities in this case. So for the next test, we're going to test for diaphragmatic excursion. Basically, what this test is how much the diaphragm moves on each breath. The less it moves, it's an indication of a disease such as COPD. The measurement should be between 3 to 6 centimeters. So for this test, I'm going to ask you to take a deep breath, and then when you exhale out, hold it, please, okay? Please take a deep breath, exhale, and hold it. So I'm going to percuss. I'm going to resonate until I feel dullness. Okay, you could breathe normally. So we could mark this area, and then we're gonna do the same, but this time you're gonna hold your breath when you have the air in your lungs. Okay, so breathe normally, then take a deep breath and hold it. Okay. Okay, so it's this area. You could breathe normally, please. So we measure it, and let me see if I have my ruler. It's here. We're gonna measure it, and it's around 4 centimeters. So that's within the normal range, and that means when he breathes in and out, the diaphragm is within the normal value we're expecting. So now we're gonna move on to auscultation. Once again, we're going to auscultate all fields of the lung from the apex to the bases. So every time I touch you with the stethoscope, please take a deep breath. Let me know if any time you feel a little lightheaded. We could stop and give you a little break, okay?
Okay.
Okay. And we should not be forgetting the lateral sides, especially the right middle lobe, okay? So he had clear lung sounds. There was no adventitious lung sounds. So another test we could do with auscultating, it's what's called the bronchophony and egophony. So we're going to try the egophony. For the egophony, we're going to be auscultating the same sites. And I'm going to ask our patient to say E. And when he says E, we should hear normal. We should hear a muffled E sound. If it's clear and it sounds like A, it could indicate consolidation or it's an abnormality. So Mario, every time I push the put this in, just keep on saying E, okay? Just let me know if you need to rest at any point, okay?
Okay. E. E. E, 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 E.
Okay, so they were muffled and they were not distorted. The next one is bronchophony, and for this one it's the same thing, but he's gonna say 99, and the word 99 will also should appear muffled. If it sounds very clear, it could be an indication of some consolidation. Okay, well, every time I put the scope, please say 99. Let me know if you get tired at any point.
Okay. 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, so I believe this concludes our respiratory examination. Thank you.